Welcome to everyone watching this video. This short educational presentation is mostly aimed towards medical practitioners who treat patients with venous insufficiency and lymphedema. I will discuss various types of compression garments, the therapy and treatment options that are available. Enjoy this video. Compression therapy is the conservative treatment and the footstone for patients with venous insufficiency. The mechanisms of the operation are to increase venous flow, reduce venous wall distension, and improve valvular function in order to reduce the venous hypertension of the limb, improve venous hemodynamics, decrease the symptoms of the swollen extremity, and finally to maintain the gradient pressure of the limb. This ultimately helps improve the venous return from the distal to the proximal region. Medical compression stockings or bandages with gradual compression from distal to proximal regions are usually utilized to conduct the compression therapy. There are two main principles of compression therapy. The first one is to create an enclosed system in order to allow an evenly distributed internal pressure in the leg. This principle involves the application of Pascal's law, which entails muscle movement generating a pressure wave that is distributed evenly in the lower limbs during active and passive exercise. The compression effect can reduce the diameter of veins by positioning valves and forcing the venous blood to return to the heart. The second principle involves the application of Laplace's law in order to create a varied interface pressure based on limb shape as well as the tension of the stocking or bandage applied. While many manufacturers and suppliers will claim that their stocking provides the best compression, not all stockings are made equal. Compression stockings are manufactured in a circular and flat weave, with the latter being more robust, retaining its mechanical properties for longer than circular woven garments. We normally keep a small quantity of stock of the most popular brands from Germany, Switzerland, Italy, Turkey, and France. Not everyone can use a compression stocking. So many have created this garment called the Juxtafit, and it's basically very similar to the Faro wrap, and it's a wrapped garment. Now, the first thing a person would do is obviously put on the interface sock, and the sock is just really to protect the skin if a person has any allergies to the actual neoprene. The garment is then very easily applied, starting at the posterior and just beginning the wrap proximal, so that you can get a nice tight wrap on the proximal around the calf just to create the anchor. Once the anchor is in place, the garment will then be wrapped around the distal part, slightly above the malleolus. You basically then positioning the straps, and then once these straps are in the correct position, you would use the measurement chart to make sure that you've got the correct tension. There's the measurement chart, and then you could just use the measurement chart to check the tension. This is a foot piece. The foot pieces then can be added afterwards, especially if there's edema around the foot. Just has to be cut to size, and then that gets wrapped around the foot section tight enough to apply pressure and not too tight so that it causes discomfort. Here you can see the thigh section being applied, and it's pretty easy. Obviously also starting off anchoring at the proximal area and then beginning your wrapping distally just above the knee. Compression garments can be extremely difficult to don for some people. So that's why some of these companies have brought out great inventions to help people to don these stockings. You'll see this one over here specific is called the Medi Butler. And the Medi Butler can be used for a very large or for a very small leg. And you just basically fold the stocking over the inner wire contraption. And once that's in place and the heel component is in place, you'd push your foot straight into the garment, and then you use a bit of counter force to lift the garment up so that you can don the garment completely. There's another invention called the Easy Donner that uses a rubber membrane of sorts, and you then pull the stocking directly over it. It's got a anchor that anchors directly onto a smooth surface. Once you've used the anchoring device to roll the stocking onto the membrane, you can now see where the toe section would be and line up the membrane with the heel and where the toe must go in, and then you would apply it directly onto the foot for quite easy donning. These two devices are not the only devices that you can use to don the stockings, but they are by far the most cost-effective on the South African market at the moment. Venous ulcers are extremely difficult to treat with conventional wound care. Experience and objective scientific evidence tells us that these wounds require compression garments to heal. A few suppliers now have a Bologna ulcer kit. These stockings are much easier to fit than applying a 3-layer bandage, increasing patient compliance. The treatment normally requires a single stocking worn at night, with the second stocking added on top of the first stocking, which is then worn during the day while the patient is active. The most prescribed stockings are normally your Class 1 and Class 2 garments. Your Class 1 garments are normally for your mild venous insufficiencies, and that would normally be rated at 10 to 20 millimeters mercury. The Compression 1 stocking can also be used prophylactically to prevent deep vein thrombosis for a person who is maybe doing flying or sitting for long periods of time. And also for spider veins and mild swelling. Then you've got your Class 2 stocking, which is your 20 to 30 millimeters mercury. These are going to provide a little bit of a better compression and can be used then for varicose veins and for mild lymphedema. Your Class 3 and Class 4 stockings are not easily tolerated by patients, but in some cases, it's much needed and a great help for patients with lymphedema. Now, for lymphedema in the lower limb, the action principle of compression stockings are said to improve the calf muscle pumping on the veins, as well as to help the lymph propulsion by enhancing the extrinsic forces such as contractions of the skeletal muscles adjacent to the lymphatic vessels. Tuan has developed the self-adjustable garment designed to mobilize edematous or indurated subcutaneous tissue. The Mobiderm Autofit is particularly indicated for clients with chronic edema and who wish to control their lymphedema independently. The Velcro fasteners allows easy donning and doffing, facilitating morphological adaptation. The sole of the lower extremity Autofit garments are also lined with anti-slip pads. Cool. The German company Medi manufactures a wide variety of flat and circular weave compression garments. Not only do they provide compression garments, but also provide many supporting products like day gels, skin adhesives, donning butlers and application gloves. Compression therapy has also been successfully utilized for burns. Recently, compression garments are also used to facilitate quicker recovery time and lessen the incidence of injury amongst athletes, thereby enhancing their performance. It is widely known that two of the most universally accepted pathophysiology of venous insufficiency are primary valvular incompetence and congenital vein wall weakness, and this affects 30% of the population. So when prescribing compression garments, every unique body shape requires utmost care when measuring and fitting to ensure the safety and well-being of your patients. Thank you for watching this video, and trust that you have found it to be informative in facilitating your patient's road to wellness. In appreciation, from my heart to yours, Neil.